This is Blood and Cancer News, the official news podcast of MD Edge Hematology, Oncology, and the Medscape Professional Network. I'm Nick Andrews. Remember, you can email Blood and Cancer at podcasts@mdedge.com, and you can follow us on Twitter at mdedgehemonc. Coming up today, we check in on acute myeloid leukemia and how difficult it is for relapsed refractory patients, and a new mandate will give patients immediate access to clinical notes. We begin today with new data suggesting that national guidelines failed to classify many younger African American lung cancer patients for lung cancer screening. This is according to a retrospective study that was presented at the annual meeting of the American College of Chest Physicians. In the study, the researchers reviewed 1,500 medical records of patients with newly diagnosed lung cancer from the LSU Health Sciences Center between 2011 and 2015. The researchers found that about one-third of the lung cancer patients in the cohort study were diagnosed before the age of 55. This means that those patients would not have been recommended for screening with low-dose CT based on the 2013 lung cancer guidelines from the USPSTF. The researchers then aimed to classify those who were eligible for screening based on NCCN guidelines. Those guidelines recommended low-dose CT in patients who were 50 or older with at least 20 pack-year smoking history and a 6-year risk of lung cancer of at least 1.3%. After applying risk stratification, the researchers found about 12.5% of patients who were ineligible for screening would have been categorized as high risk and would have been recommended for screening. And of that group, 2/3 were African American. The finding highlights a health disparity issue that may be addressed through an update of the guidelines, which is currently in the works. That's according to Dr. Carol Velez Martinez, who's a PGY3 internal medicine resident at LSU Health Sciences Center in Louisiana. She said that she is looking forward to the formal recommendation from the USPSTF. The 2013 USPSTF guidelines were based on benefits that were observed in the National Lung Screening Trial, which indicated 20% relative risk reduction in death from lung cancer. However, Dr. Velez Martinez said that the generalizability of the study beyond white males has been questioned. Indeed, about 90% of the NSLT participants were white, and 59% were male, according to the results. Those were published in 2011. Other studies have shown African Americans more likely to get lung cancer than whites, despite comparable smoking rates between the races, and that African American men are more likely to die from lung cancer than white men. Dr. Velez Martinez pointed out that many African Americans live below the poverty line, which means they have limited resources for insurance and health providers, and these patients who also participate less often in clinical trials. And patients who have relapsed refractory acute myeloid leukemia continue to face poor prognoses, and there is still no exact standard of care. This is all despite a variety of options for physicians. Dr. Ihab Attallah is a professor of medicine at the Medical College of the University of Wisconsin-Milwaukee. He presented an update on the current AML situation at the 2020 Acute Leukemia Forum of Hemeticus. Dr. Attallah said that there is clearly a problem with this relapsed refractory group of patients. In his presentation, he noted a 2018 study of just over 3,000 patients which showed poor outcomes for relapsed refractory patients. At a median follow-up of 9.7 years, 59% of patients reached first complete remission, and 58.9% of those patients relapsed. And in the relapsed patients, the median overall survival for relapse was 0.5 years. The overall survival for 5 years was 10%. In the study, patients who relapsed with better prognostic factors, there was no significant OS differences between the studies. The authors of the study concluded in their study that their findings appear to confirm that the survival of AML patients post-relapse continues to be dismal and has not improved during the past quarter century. Dr. Attallah said that there is not a clear standard of care. This is shown by a 2014 phase 3 study of elisaterabine versus investigator choice in relapsed refractory patients. Those researchers chose 7 treatment options for the control arm. 7. So how can physicians make the best decisions about treatment now? Dr. Attallah points to a 2018 report that finds some factors do offer guidance about how well relapsed patients will do, including worse prognosis for an age of 50 or older, the time to relapse being less than 1 year, and the number of cycles of treatment that were needed to achieve remission, as well as unfavorable cytogenetics. Dr. Atala also said that you should keep comorbidities in mind and consider previous therapies. He continued by saying that in the big picture, there are many patient variables, disease variables, and therapy variables that are involved in decision-making, and that even with the current choices for relapsed refractory disease, the overall survival remains poor, and the enrollment in clinical trials would be the best option for these patients. And finally today, starting on Monday, November 2nd, 2020, all patients in the U.S. will be able to access clinical notes, including doctor writings, test results, and pathology reports. The 21st Century Cures Act mandates that patients have fast electronic access to the following types of notes: consultations, discharge summaries, history physical examination findings, image narratives, laboratory and pathology report narratives, and procedure and progress notes. Some physicians have said that despite the open notes mandate, it is potentially confusing and frightening for patients. Other doctors worry that this change will increase the workload as clinicians tailor notes for patients and answer related questions. The law means that inpatient and outpatient notes will be released immediately, and that patients will have immediate access to testing and imaging results, including results from sexually transmitted disease tests, Pap tests, cancer biopsies, CT and PET scans, fetal ultrasounds, pneumonia cultures, and mammograms. Such notes could contain sensitive information, and there is concern that patients could be shocked, confused, or annoyed by what they read, even for the run-of-the-mill notes. Champions of the open notes law say that the benefits, including better provider communication, greatly outweigh such risks. You can find more clinician analysis on this new mandate by clicking the link in the show notes. And that's it for this edition of Blood and Cancer News. I am Nick Andrews. Blood and Cancer is produced by MD Edge editor Jennifer Smith and Mark Lesney. All of our podcasts are produced by executive editor Kathy Scarbeck. I am your audio engineer and your audio editor. You're listening to Blood and Cancer.